It's great to be here. Good afternoon. Just quickly, just to let you know, we are at an unprecedented moment in the HIV/AIDS pandemic. For the first time in modern history, we have the opportunity to actually control the global pandemic without a vaccine or a cure. And this is a very exciting time for us. The United States remains the key leader of the HIV/AIDS response, and under this administration and leadership of President Donald Trump, we are continuing to lead in the response around the globe. Today we announced the President's Emergency Plan for AIDS Relief, or PEPFAR, historic highs, as just noted by Heather. We're actually preventing more HIV infections and saving more lives than ever before, and we're doing this driven by transparency, accountability, and cost-effective investments. One big reason for our great success in this last 12 months is we've really refined our approach and expanded our impact based on using the latest science around the globe that's available to us and the best available data, including data down to the actual sites of where they're delivering services to our clients. The results in enormous efficiency and cost effectiveness across the program. We're also ensuring that we have the greatest impact with our every dollar that's entrusted to us from the American public, both demonstrating the generosity and the compassion of the American people through their taxpayer dollars. When PEPFAR began in 2003, less than 50,000 people were on treatment in sub-Saharan Africa. Entire communities were decimated. Children were living without mothers and fathers. Schools went without teachers. Hospitals went without nurses and doctors. And today, in these same areas, we have nearly 13 million people on treatment because of PEPFAR. In addition, we've been focused over the last year heavily in prevention and preventing new infections in men and boys. We're using a new biomedical intervention, voluntary medical male circumcision. It's reached a historic high of 15 million, 3.4 million circumcisions just done in the last 12 months. And I think the most important announcement we have today, for the first time in the history of HIV/AIDS, we're announcing a dramatic decline in infections in young women and girls due to our DREAMS program. Stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Young Women. We were in 63 districts, but 14 of them had more than a 40% decline in the infection rate in young women. Another 27 had declines of 25 to 40% in the rate of new infections, and nearly all the districts saw some improvement in the rate of infections in young women and girls. And this is the first time we've been able to have that kind of dramatic impact. It's this public-private partnership. It brings the strength of the private sector with the U.S. taxpayer dollars to have and augment our response, and we're very excited about that results. Finally, within orphans and vulnerable children, we're reaching over 6 million orphans and vulnerable children. We've prevented 2.2 million babies from being born with HIV because of care for their mothers and making sure that they receive life-saving treatment that both saves their lives so that they can be a mother to their children, but also prevents infection in their babies. So together today, we are excited about these new announcements, but we're also using this time to commemorate all of the people that we have lost to HIV/AIDS, really renewing our effort to have even a bigger and better and greater response over the next 12 months and have the impact that we believe can end up with controlling this pandemic over the next 3 years.